Let's talk about cervical checks and understanding dilation, effacement, and station. When you're in labor, you can consent to a cervical check, and this means that generally you'll be laying down on your back, and a doctor, nurse, or midwife will be inserting their fingers into your vagina looking to see how dilated, effaced, and what station baby is at based on the status of your cervix. When you are not in labor, your cervix is typically long, thick, and firm, kind of like if you were to press on the tip of your nose. And this is what we would look at as far as determining change when we're looking at dilation, effacement, and station during labor. It is really important to remember that cervical checks are not mandatory, but sometimes they can help you make decisions. So I usually recommend getting them upon admission if you want to. And then if you're planning an unmedicated birth, you don't need to get another one at all. But if you are hoping to maybe get an epidural or you're not sure about it, getting a cervical check can help kind of determine how getting an epidural would go and if it's necessary, if that's what you want. Dilation is typically the only factor that we know about when it comes to looking at your cervix, but it's really important to remember that your cervix will go from 0 to 1 and then all the way to 10 centimeters, as I'm going to show you here on my dilation wheel. And I know it looks really scary, but it's what our body's meant to do to get the baby out. When we're talking about effacement, we're looking at the overall thinness of your cervix and how it goes hand in hand with dilation. In this next clip, I'm going to take you through an example of how we use a balloon and a ping pong ball to imitate the process of the baby's head, helping to dilate and efface your cervix. So inside this balloon is a ping pong ball, acting as the baby's head, pushing on the cervix. As you can see here, the cervix is nice and long and thick, and it's not ready to have a baby. And then you can see the shadow of the baby's head. Here I'm going to push down on the very top of the uterus to act like true contractions. And with every contraction, you can see the baby's head come down a little bit lower and lower into the cervix. And it's slowly starting to dilate as it starts to efface. Each contraction a little bit lower and slower. Here we're going to speed it up a little bit. Here you can see that I'm going to show you how the cervix is effacing and it's becoming more dilated as baby drops lower and lower. The baby's head is bulging there a little bit. And I'll show you here in a moment that the cervix is completely effaced. There's no cervix left. This next part would be a stimulation of what pushing kind of looks like. So again, as she's pushing down, the cervix is fully dilated, but baby still needs to kind of break through that perimeter. I'm going to show here that the cervix is fully dilated. You can see the top of baby's head. There may be just about crowning in this next scenario, as you can see. And baby is born. Yay! Dilation and effacement are really focused on your cervix, but the baby's station, which is their position in relation to your ischial spines, is incredibly important to know how everything is progressing and how engaged baby is. So when people talk about baby dropping, this is them getting from this -3 position, if you look at the lines here, and dropping down into like a -2, -1 space, and you can feel the baby physically drop away from your rib cage and drop down into this lower space. So for just a little bit more information on baby's positioning, if baby is in the -3 space, they're pretty high up, they are not engaged. -2 and -1 are part of the process of baby dropping down and laboring as everything's dilating and effacing. And the goal would be to be at either 0 or +1, +1, when you want to start pushing. And this is because sometimes if you get to 10 centimeters, you may not have baby fully engaged. And just so that you can have a better time pushing, it's often better to wait until you're at 0 or +1 station.